Good morning and welcome back to my channel. Let me say happy new year to all my subscribers and all my listeners. So this morning I will be talking about drugs and pregnancy. Drug and pregnancies. So our title this morning is common drugs you should mind in pregnancy. Now this is very important because many women in our country, our villages, they don't go to antenatal. Some of them will be in their 7th month, 8th month. Maybe one emergency will take them to some, let me call them maternity home or some clinics that you don't have a good care facility or even some professional. You find out that a lot happen talking about drug, and these women, some of them, they are not informed. Some of them, they do something, they are even scared to confess what they did. So apart from malnutrition, drug is one of the things that deform people in Africa. So I'll be talking about some drugs that very common drugs that you should mind because they don't have access to pharmacists to educate them. They go to Google and they cannot even process the information correctly. And more so, drug control is very loose in our world. People have access to all kinds of medications, and it's a problem to, especially to the next generation, talking about mothers. So very quickly this morning, what I try to do, I try to highlight some of those I try to bring out drugs from those common conditions that affect pregnancy. For example, many pregnant women will experience hyperacidity, heartburn, chestburn, because naturally the womb is seated below the stomach. So as the pregnancy grows, the fetus, the womb, they are going to push up the stomach. That means the content is going to be coming to the esophagus, close to the chest and the throat. That is why many women experience heartburn. Now, many drugs for heartburn will be safe in pregnancy, in quotes, but you should mind what they should mind. They should be careful with any label that contain bismuth subsalicate, bismuth subsalicate or bismuth salicate. Most of the label has a bismuth subsalicate. Now, this is also an antacid. It's also used as anti-diarrhea medicine. You have it in brands like Pepto-Bismol. I don't have any issue with the company that make this brand, but just for educative purpose. So this antacid, because of salicate, it can actually pose a real threat to the baby. So please be aware. And let me quickly say this. There are many drugs that are not safe or that may have issue with pregnancy. I am only picking some common drugs that people have access to in Nigeria. And this categorization, the drug categorization in pregnancy take into consideration a lot of factors. For example, the dosage. The same drug, if you take low dose, it might be safe. If you take very high dose, it might become a problem to the mother and the baby. The same drug, depending on the time of pregnancy is taken. Is it the early pregnancy? Is it the middle? Is it the end? So some of the drugs I'm mentioning here, they are not to be taken at all. You must avoid them. Fine, some drugs are given considering the benefits. If you see that if you don't use those drugs, the consequences will be more. So you will want to use it even if it might not be 100% okay, even if it's going to stress the mother and the baby. But I'm talking about drugs that you have options. You don't have to use them, and even their use is going to endanger either the mother or the baby or even both. So let's go. First is antacid, bismuth subsalicate. Bismuth subsalicate should be avoided during pregnancy. Use under antacids, please. Now next on this is painkillers, body pain analgesic. Common analgesics like aspirin, indomethacin, ibuprofen, diclofenac. I mentioned some things about NSAIDs in my previous lecture when I was talking about 15 lifestyle measures to avoid or to adjust to get a full recovery from ulcer, stomach ulcer. So the problem with NSAID is that they tend to cause bleeding. They can disturb the baby hemostatic apparatus. They can influence the baby, the fetal hemostatic mechanisms, and most of them can actually cause early closure of ductus arteriosus. Ductus arteriosus is like a form of lungs for the baby. No, not lungs. It's a tube that replaces the lungs because the baby is not taking air directly from the environment. It's not taking oxygen. So the baby circulation flow through that tube called ductus arteriosus. Now, NSAID can actually close this tube too early, and that is going to cause congenital heart problem, heart abnormality. So too much use, overuse of NSAID in pregnancy can cause heart conditions in baby. You have to know this. So as much as possible, fine, NSAIDs, all this fevin, ibuprofen, aspirin, they are common. You buy it from chemists everywhere. But I'm telling you that they can lead to heart problem in your unborn baby. So as much as possible, do not take painkiller on your own. and try and verify every drug those street nurses and street doctors, chemists will give to you. Now, next on this is blood pressure drugs. We know that many women, they come down with hypertension during pregnancy. Actually met a lady who went to scan in her 7th month and her baby's already dead. Kudos to Lisinopril. This woman was placed on Lisinopril by her doctor, and she has been on it faithfully, only for her to lose her baby around 7th month. So there are a lot of drug that bring down high blood pressure. For pregnancy, you must be very mindful of drug called Lisinopril and other members, other similar drugs. The Lisinopril drug has, let's say, brothers. You have the Lisinopril are called the angiotensin converting enzyme inhibitors, ACEIs. Well, you can forget that long word, but when you look at a BP drug, most of these class they end with RIL. You are going to say something like Lisinopril, Ramipril, Perindopril. Now, the list is long, but you can easily see the acronym ACEIs, and do well to ask before you swallow BP drugs given to you, especially by chemists, especially by nurses, doctors on the street, without not from accredited health facility. Then a similar drug is losartan. Now, losartan also share mechanism with Lisinopril. They act in similar way, and there are a lot of this losartan have other related drugs or member of the family, like let's say he has brothers like candesartan or mesartan, valsartan. These people, these members, these drugs, they end with the tans. You will see sartan at the end, at their surface. So this drug, they actually walk through the kidney. So in neonates, in fetus, they damage the kidney. They also they restrict intrauterine growth. They can, because they're anti-proliferative agent, they can also restrict the fetal growth. So as much as possible, if your doctor is making the mistake of prescribing this to you for high blood pressure during pregnancy, please do well to notify the doctor to check the profile, or your chemist, the street people, or even family. Nigerians have a funny habit of giving their own drug to their family member or friends. Please avoid this drug. I told you of a recent case I had with this drug. One of my patients, she went for scan and her baby is already dead, and this woman confessed that she has been on Lisinopril from, I think, 2nd month, because she became hypertensive in 2nd month, and she has been on Lisinopril. So please avoid Lisinopril and its member or similar drugs, and losartan and similar drugs. Now, next on this is some facial creams. We know a lot of pregnant women come down with acne, pimple. Now, drugs, people often argue that topical agents cannot cause harm to internal organ, let alone fetus. Well, please hear it from me. There are things that you touch, there are things that you rub that can absorb into your body, and they are going to destroy the internal organ. Not only internal organ, they can even touch your DNA and affect your next generation. In one of my videos, when I was talking about sexually transmitted drug, I mentioned of finasteride and dutasteride, that even a pregnant woman or women of a childbearing age should be careful with those drugs. Even touching them, if you are pregnant, touching them put you at risk, because they can absorb through your palm and they are going to be very harmful to your baby. So retinoid like products, there are a lot of them, like tazarotene and the others. Fine, the absorption is little, but even in that little absorption, they can destroy your baby in the womb. They can cause some serious malformation. So please avoid retinoid like products for pimple during pregnancy. Then next on this, there are common antibiotics, the one they call flagyl, metronidazole. People are always at ease with this drug, but I want to warn you, flagyl has been implicated in cleft palate. The roof of the mouth will not be well formed. It can cause malformation. Please, pregnant mothers, pregnant women, avoid the abuse of flagyl during pregnancy. Metronidazole, I don't have a problem with the I think that is Sanofi, that brand, the maker of that brand, but people always use the popular brand to represent the medication. People on the street, they know it as flagyl. Please be careful. It's not as it seems. People believe that it's so safe, but fine. Cleft palate, I think the operation is free in UBTH today, but the stress, the pain, and not everybody even have the information that cleft palate surgery is free. So please avoid flagyl, avoid metronidazole in pregnancy. There are always options. Then tetracyclines are bad for growing baby and even for pregnancy. It can affect their bone, it can affect their teeth. Then the recent one I had is weight. The lady want to control weight in pregnancy because her friend did it. Her friend gave her Orlistat. Please, Orlistat can kill your baby. Orlistat is not for pregnancy. You don't need to control the weight during pregnancy. All you need to do is to do exercise, eat adequately, but not so much so that you don't gain unnecessary weight and become diabetic. But do not use Orlistat during pregnancy. This is the second reason I'm making this video, or I'm doing this teaching, because last week here, a lady almost fought with me because she want Orlistat. She want to control weight in pregnancy. She was even arguing with me that her friend said she used it. So he did not tell me the outcome of that friend pregnancy. So I don't know whether she's lying or not, whether the friend has a live birth or the pregnancy did not progress to completion. But I'm telling you, avoid not only Orlistat, in fact, weight control pills, but Orlistat is very bad. So thank you. Please subscribe to my channel, share my video, like my video, so that we encourage to do more. God bless you. Happy New Year again till we come your way.